Dr. Peirone, you spoke about fractures in the cat. What has changed in the size of implants recently?
Yes, cat fracture in the past were not treated successfully due to the dimension of the bone, and so we didn't have a proper implant to treat this fracture. But recently, with the miniaturization of the implant, we are using implants that come from the human side, implants that are used for mandibular fracture. Now we are able to repair even a very bad fracture with this implant. Also because cat, is a very active animal, a lot of muscle, is a small tiger, and we are used to say that cat is a leg and hand animal, and so it tries to climb, particularly if you live in a flat. He's used to go outside and maybe can fall, so cat may report very horrible, highly comminuted fracture. And to treat this fracture effectively, we need proper implant, and actually we have this locking plate that provide a very good stabilization, fracture fixation, even by means of 2 screws for each segment, that typically are the fracture pattern, the fracture scenario we see in cat. Small proximal segment, small distal segment, and in the middle, a comminuted area. So our rationale to treat this fracture is to decrease the surgical footprint, try to use a biological approach. Typically, we use a MIPO technique, so minimal invasive plate osteosynthesis. We do achieve a fracture alignment by inserting an IM pin, and then through very small approach, proximal and distal, we put the plate, we slide the plate underneath the muscle over the bone, and we do realize a so-called fracture alignment. And we see the results that are quite amazing, because we see bone healing within 2 months. And this is due to the mechanical properties of this implant joined to this biological approach.